One part of the problem is the uninsured. And this morning, the Census Bureau released new data showing not only that the poverty rate increased last year at the highest rate since the early 1990s, but also that the number of uninsured rose in 2008. And we know from more up-to-date surveys that since the recession intensified last September, the situation's grown worse. Over the last 12 months, it's estimated that the ranks of the uninsured have swelled by nearly 6 million people. That's 17,000 men and women every single day. And we know that during this period of time, the number of adults who get their coverage at the workplace has dropped by 8 million people. But I don't have to tell you about all the problems plaguing the healthcare system and the fact that they don't just affect the uninsured. Most Americans do have insurance and have never had less security and stability than they do right now. Because they're subject to the whims of health insurance companies, many people fear that they'll lose their health insurance if they move or if they lose their job, they change jobs, or that insurance just won't cover them when they need it the most. The reason I need nurses so badly is because now's the time to act, and I will not permit reform to be postponed or imperiled by the usual ideological diversions. We don't need more partisan distractions. If there are real concerns about any aspect of my plan, let's address them. If there are real differences, let's resolve them. But we have talked this issue to death, year after year, decade after decade, and the time for talk is winding down. The time for bickering has passed. We're not the first generation to take up this cause, but we can and have to be the last.